So, hello students, and let us understand this lecture, the functional components of the nucleus. Students, now that we've seen the ganglions in the head and neck, now you've got an idea about the cranial nerves, where they begin from, what they supply. Let us understand this functional components. If this is clear, your orientation and your understanding of the cranial nerves would be easy. It would be better to understand. I mean, it would be easy to understand the cranial nerves then. Okay, so let us understand the functional components of the nucleus. Now, this is made up of two parts. One is the efferent component and the other one is the afferent component, efferent and afferent. Now, understand this. Say there's a cranial nerve. There's a cranial nerve. And this cranial nerve has to supply the muscles which are derived from pharyngeal arches. Now, this embryology we'll be seeing later, but just to brief you, there are 6 pharyngeal arches to begin with, out of which the 5th goes off, the 5th disappears off. So now there are 5 pharyngeal arches, 5 pharyngeal arches. Each arch will have a nerve of its own. In each arch, there are muscles also present. So the nerve is going to supply the muscles of the arch, right? Since the beginning of the lectures, we've seen the mandibular nerve, students. You remember mandibular nerve is a nerve of which arch? Mandibular nerve is a nerve of the first pharyngeal arch. And now you know the muscles supplied by the mandibular nerve, and all those muscles are derived from the first arch. Hence, they are supplied by mandibular nerve. Nerve of the second arch is facial nerve. Nerve of the third arch is glossopharyngeal nerve. And the nerve of the fourth arch is superior laryngeal, sixth arch is recurrent laryngeal, both are branches of vagus. Fourth is superior laryngeal, sixth is recurrent laryngeal, both are branches of vagus, right? So, if there's a nerve, and this nerve has to supply the muscles of pharyngeal arches, it needs to have a component in its nucleus. The nerve should have this component in its nucleus. Only then the nerve is able to supply the muscles of pharyngeal arches. What is the name of this component? Just try to understand this. The name of this component is the special visceral efferent component. Special visceral efferent component. Special visceral efferent component, or this is also known as the branchiomotor. Branchiomotor component. Okay, so special visceral component, special visceral or the branchiomotor component. Now this component a nerve should have in its nucleus. Only then this nerve will be able to supply the muscles of the pharyngeal arches. In other words, what is this component supply? This special visceral efferent component, what is it going to supply? It supplies the muscles of, pharyngeal arches. Clear? It supplies the muscles of pharyngeal arches. So this special visceral efferent component supplies the muscles of pharyngeal arches. It is present in which cranial nerves? Okay, it would be present in the nerves of the pharyngeal arches. Now we know the nerves of the pharyngeal arches, and this nerve will have this component. So which are the nerves of the pharyngeal arches? 5th, the nerve of the first arch is 5th, the nerve of the second arch is 7th, the nerve of the third arch is glossopharyngeal, and the nerve of the 4th and 6th arch is vagus, right? So this component is present in the 5th, 7th, 9th and 10th cranial nerves. 5, 7, 9 and 10 cranial nerve. And this nerve will have their own nucleus. They will have their own nucleus. So what is the name of the nucleus of 5th nerve which belongs to this component? Okay, so the name, I'll just tell you, the name of the nucleus is the motor nucleus of trigeminal nerve. The motor nucleus of trigeminal nerve. What does this motor nucleus of trigeminal nerve do? This motor nucleus of trigeminal nerve is going to supply the muscles of the first pharyngeal arch. And this motor nucleus of trigeminal nerve belongs to which component? The special visceral efferent component. Special visceral efferent. This component supplies the muscles of the pharyngeal arches. This component is present in 5, 7, 9, and 10 cranial nerves. And what is the name of the nucleus that I'm telling you? Slowly, slowly, you'll understand this. It is a difficult topic. Now, what is the name of the nucleus of seventh nerve? Seventh nerve is going to supply the muscles of second pharyngeal arch. So what is the name of the nucleus of facial nerve? That's the motor nucleus of facial nerve. The motor nucleus of facial nerve is going to supply the muscles of second pharyngeal arch. This for the 9th, 10th, and there is one more nerve, that's a cranial part of the 11th nerve. The cranial accessory goes with the vagus. Cranial accessory goes everywhere with the vagus. So for the 9th, 10th, and cranial accessory, there's a common nucleus, and that is the nucleus ambiguous. So what is nucleus ambiguous, students? Nucleus ambiguous is a common nucleus. Clear? Nucleus ambiguous is a common nucleus for 3 nerves. Is this clear? So nucleus ambiguous is a common nucleus for 3 nerves, the 9th, the 10th, and the cranial accessory. And this nucleus ambiguous is going to supply the muscles of the 3rd arch for the glossopharyngeal nerve, the 4th and the 6th arch for the vagus nerve. See, students, understand. Understand, what are we discussing? Functional components. The first functional component is special visceral efferent. What is this component going to supply? Muscles of the pharyngeal arches. This component is present in which nerves? 5th, 7th, 9th, and 10th cranial nerves, the nerves of the pharyngeal arches. And these nerves will have their own nucleus. What is the name of the nucleus of trigeminal nerve which supplies the muscles of first arch? Motor nucleus of trigeminal nerve. What is the name of the nucleus of facial nerve which supplies the muscles of second arch? The motor nucleus of facial nerve. And for the 9th, 10th, and cranial accessory, there's a common nucleus, that's a nucleus ambiguous. Nucleus ambiguous. You will understand this, it takes time. So that's the first functional component. Now, there's a nerve, and this nerve has to supply the glands. We've just seen this in the previous lecture. A cranial nerve has to supply the glands. The nerve cannot just go and supply the glands, students. This nerve should have another component in its nucleus. Like to supply the muscles of pharyngeal arches, what was the component which the nerve should have? Special visceral efferent. Similarly, to supply the glands, the nerve should have another component in its nucleus. The name of the component is general visceral efferent. You understand this? This is the general visceral efferent component. General visceral efferent component, this is also known as the secretomotor. Secretomotor component. Now, what is this component going to supply? The secretomotor or the general visceral efferent component. It supplies the glands. It supplies the glands. Okay, now this component represents what? We've seen parasympathetic nervous system. So this component represents the cranial outflow of This component represents the cranial outflow of parasympathetic nervous system. We have seen this last time, parasympathetic nervous system. Okay, so this component represents the cranial outflow of the parasympathetic nervous system, and this component is present in, tell me, which are the nerves which supply the glands? Which are the nerves which supply the glands? All the glands in the head and neck are supplied by which nerve? Facial nerve, right? Except parotid. Yes, except parotid, it is supplied by which nerve? Glossopharyngeal nerve. What is the vagus nerve supply? The glands of GIT. And the third nerve is an exception. Third nerve does not supply any glands. Still, we include the third nerve in this component because see the second point, this component represents what? The cranial outflow of the parasympathetic nervous system. So we include the third nerve. The third nerve does not supply any glands, but third nerve represents the cranial outflow. That is why I include the third nerve. So 7th nerve supplies all the glands in the head and neck, right? And what is the name of the nucleus of the 7th nerve to supply all the glands? That's the superior salivatory nucleus and lacrimatory nucleus. Superior salivatory nucleus and the lacrimatory nucleus. Name of the nucleus of 9th nerve is inferior salivatory nucleus, inferior salivatory nucleus. Name of the nucleus of vagus is the dorsal nucleus of vagus. Dorsal nucleus of vagus. And name of the nucleus of third nerve to supply the sphincter pupillary and ciliaris muscle is Edinger-Westphal nucleus. See, if this is clear now, your cranial nerves is going to be clear. Cranial nerve. The name of the nucleus of third nerve is Edinger-Westphal. See, a nerve, if it has to supply the glands, it should have a component in its nucleus. What is the name? General visceral efferent or secretomotor. Now, this nerve supplies the glands. This nerve represents this component represents the cranial outflow. Present in which nerve? Seventh nerve. Supplies all the glands except parotid. The name of the nucleus of the seventh nerve to supply the glands, superior salivatory and lacrimatory. But belongs to which component? General visceral efferent. Ninth nerve ka nucleus? Inferior salivatory nucleus. Belongs to which component? General visceral efferent. 10th nerve, dorsal nucleus of vagus, and third nerve, Edinger-Westphal nucleus. It supplies the sphincter pupillary and ciliaris muscle. So now, students, if you know what a nerve is going to supply, you will get the components, and the components will have its own nucleus. I'll make it simple. Say for example, ninth nerve, glossopharyngeal nerve. Glossopharyngeal nerve supplies what? Number one, glossopharyngeal nerve supplies the parotid gland. Parotid. To supply the parotid gland, what is the component which the glossopharyngeal nerve should have in its nucleus? General visceral efferent. Okay, so what is the functional component of the glossopharyngeal nerve to supply the gland? General visceral efferent. And what is the name of the nucleus of glossopharyngeal nerve to supply the parotid gland? That's the inferior salivatory nucleus. Following this, what else does the glossopharyngeal nerve supply? It's a muscle of third arch. It's a nerve third arch. It supplies one muscle in the third arch, that's stylopharyngeus. So to supply the muscle of the third arch, what component should the glossopharyngeal nerve have in its nucleus? Yes, what is the name of the component? Special visceral efferent. The glossopharyngeal nerve should have to supply the muscle of third arch. And what is the name of the nucleus of glossopharyngeal nerve to supply that muscle? That's nucleus ambiguous. You understanding following this, that nucleus ambiguous is a common nucleus. You understanding? So glossopharyngeal nerve functional components will be number one, general visceral efferent supplies the parotid. The name of the nucleus is inferior salivatory nucleus. Second component, special visceral efferent supplies the stylopharyngeus muscle. Name of the nucleus to supply this muscle? Nucleus ambiguous. Are you following this? Clear? Is this clear to all of you? Slightly difficult, you have to revise this again and again. So now you tell me, students, facial nerve. Facial nerve also has the same components. Now, facial nerve supplies all the glands in the head and neck, right? Facial nerve supplies all the glands in the head and neck. Facial nerve gives branches. We have seen the facial nerve. It gives branches, and the branches go so far to supply all the glands. Then when the facial nerve itself is lying in the parotid, right? Facial nerve is in the parotid gland. Why is it not supplying the parotid gland? Now, facial nerve supplies so many glands, and then when it is passing through the parotid, why does it not supply the parotid? Look, I'll give one example. You've got 1,000 rupees, and you spend this money. You finish this money. You've got no money left. Now you want to buy something. Forget credit cards and debit cards. You want to buy something you cannot buy because you do not have the money to buy. So can you explain me on this basis, why does the facial nerve not supply the parotid even though it is in the parotid? Because facial nerve, after supplying so many glands, so many glands, that component which the facial nerve has to supply the glands, that's the general visceral efferent component, is over. Facial nerve doesn't have this component now. And that is why when the facial nerve is passing through the parotid, it is not able to supply the parotid. Why? Because it doesn't have the component to supply the parotid. But yes, facial nerve has one component left with it. What is that component? Special visceral efferent. And this special visceral efferent is going to supply, or the branchiomotor component, that is going to supply the muscles of second pharyngeal arch. Understand? And that is why when the facial nerve is passing through the parotid gland, when the facial nerve is passing through the parotid gland, it is not supplying the gland. Why? Because it doesn't have the component to supply the gland. Answer this. What is the relation of branchiomotor component? I hope this branchiomotor component is clear to you. Special visceral efferent component of the facial nerve to the parotid gland. What is the component? When the facial nerve is passing through the parotid gland, it is this component which the facial nerve has. The answer is in the substance of the gland, in the substance. So when the facial nerve is passing through the parotid, what is the component left with the facial nerve? Special visceral efferent or the branchiomotor, and it is passing through the gland. When would the answer be none? When would the answer be none? If the question would have been what is the relation of general visceral efferent component of the facial nerve to the parotid gland, your answer would be none, right? Because that component is over. Are you following this, students? So we have discussed two components here. We have discussed two components. One is special visceral efferent, which supplies the muscles of the pharyngeal arches present in 5, 7, 9, 10 cranial nerves. Second, general visceral efferent supplies the glands. Name of the component, general visceral efferent or secretomotor, present in 3, 7, 9 and 10 cranial nerves. Fine. Now coming to the third component. The third component is general, these are efferent components that we are talking, general somatic efferents. General somatic efferent. What does this component supply? Supplies the muscles derived from occipital myotomes. Occipital myotomes. Now, which are the muscles which are derived from occipital myotomes? Students, which are the muscles derived from the occipital myotomes? These are two muscles, extraocular muscles, extraocular and tongue muscles. Extraocular and the tongue muscles. So supplies the muscles which are derived from occipital myotomes. And these are the extraocular and the tongue muscles. So now if you can tell me, this component would be present in which nerves? The nerves which supply the muscles of the tongue and the nerves which supply the muscles of the eyeball. So this component would be present in, yes, any idea? It would be present in third, fourth, sixth. Third, fourth, sixth. These are the nerves which supply the extraocular muscle, and 12th nerve. 12th nerve. This is the muscle, this is the nerve which is supplying the tongue. Right. So this component, general somatic efferent, is going to supply the muscles which are derived from occipital myotomes. And which are this components? Which are this muscles? Extraocular and the tongue muscle. So this component would be present in which nerves? 3, 4, 6 and 12th nerve. And this nerve will have their corresponding nucleus. Corresponding nucleus. So what is the name of the nucleus of oculomotor nerve? The nucleus is the same. The name of the nucleus is the same. Oculomotor nucleus, trochlear nucleus, abducens nucleus, hypoglossal nucleus. Hypoglossal nucleus, right? So this hypoglossal nucleus belongs to the hypoglossal nerve. And what is it going to supply? The muscles of the tongue. Which component does it represent? General somatic efferent. Understanding this? Is this clear to all of you? Students, is this clear to all of you? So these are the efferent components. First, special visceral efferent supplies the muscles of pharyngeal arches. General visceral efferent supplies the glands. General somatic efferent supplies the muscles derived from occipital myotomes, extraocular and tongue muscles. So present in 3, 4, 6 and 12 cranial nerves, and these are the name of the nucleus for them. So say for example, third nerve. So what do we know about the third nerve? Third nerve supplies the extraocular muscles. Third nerve also supplies the sphincter pupillae and ciliaris muscle, correct? So what is the component for the third nerve to supply the extraocular muscles? What is the name of the component? General somatic efferent. And what is the name of the nucleus of the third nerve belonging to this component? Oculomotor nucleus. Oculomotor nucleus. The third nerve supplies the sphincter pupillae and ciliaris muscle. What is the name of the component to supply this? General visceral efferent. Name of the component. And what is the name of the nucleus? Edinger Westphal. So third nerve will have two components, general visceral efferent and general somatic efferent. General visceral efferent का nucleus Edinger Westphal. General somatic efferent का nucleus the oculomotor nucleus. So third nerve will have two nucleus. So when we write a cranial nerve, the first thing is the functional component. The second thing is the name of the nucleus. So that's how the cranial nerve goes. Clear? So I'm just telling you those functional components. If this is clear, your cranial nerves is going to be clear. So what have we discussed? Efferent components. Now coming to the afferent components. Afferent components are small. Afferent component is first afferents. Huh? This is afferents. We have discussed what now? Efferent component. So now we are talking afferent component. One is general somatic afferent. Somatic afferent. General somatic afferent. Somatic is body wall. So which is the nerve which carries general sensations from the body wall? General sensations from the body wall is carried by, this is carried by fifth nerve, trigeminal nerve. This is carried by fifth nerve through its three nuclei. Okay, so general somatic afferents, general sensations from the body wall is carried by the fifth nerve through its three nucleus. What is this three nucleus? One is mesencephalic nucleus. Mesencephalic nucleus, that's located where? In the midbrain. Okay, this mesencephalic nucleus is located in the midbrain. Mesencephalic nucleus of trigeminal nerve. Second is the chief sensory nucleus. Chief sensory nucleus of the trigeminal nerve, that's in the pons. And the third is spinal nucleus. Spinal nucleus, that's in the medulla. So through this three nucleus, the mesencephalic nucleus, which is in the midbrain, the chief sensory nucleus is in the pons, and the spinal nucleus is in the medulla. Through this three nucleus, the trigeminal nerve is going to get sensations from the entire body wall. And what component does it represent? The general somatic afferent. Afferent is coming towards afferent. So that is general somatic afferent. Coming to the second component, special somatic. Somatic is body wall. So special sensations from the body wall. Special sensations from the body wall are, one is smell. So that's the first nerve. That's olfactory nerve. Olfactory nerve. Second nerve for the vision, that's optic. First, second, right? And the eighth nerve. Eighth nerve is vestibulocochlear. Eighth nerve. First, second, and eighth nerve. So special sensations from the body wall. Which are the special sensations which come from the body wall? One is smell. Second is vision. And third is balancing. So which nerves are going to carry this? They don't have nucleus. They directly go to the brain. So which nerve will have this component? Special visceral efferent. The first nerve, the second nerve, and the eighth nerve. Vestibulocochlear nerve. First, second, and eighth nerve. So this is about somatic. Somatic is body wall. Now coming to the visceral. Visceral. So coming to the third one, general visceral. General visceral. General visceral afferent. Now general sensations from the viscera. General sensations from the viscera. Which nerve is going to carry this? The vagus. The vagus is going to carry this. And coming to the fourth one, special visceral afferent. Special visceral afferent. Now special viscera is the tongue. Special viscera is the tongue. So who carries special sensations from anterior 2/3? That's chorda tympani. Chorda tympani is a branch of facial. Special sensations from anterior 2/3 is carried by chorda tympani. Special sensations from posterior one-thirds is carried by glossopharyngeal nerve, and special sensations from the posterior most part of the tongue is carried by the vagus nerve, right? Just remember the tongue. Special sensations from anterior two-thirds, that's chorda tympani, which is a branch of facial. Posterior one-third is glossopharyngeal nerve, and the posterior most part is the vagus nerve. So for the 7th, 9th, and 10th nerves, there's a common nucleus, and that's the nucleus of tractus solitarius. That's the nucleus of tractus solitarius, right, students? So just understand this. So what does the nucleus of tractus solitarius represent? Which functional component? Special visceral afferent. Just remember the tongue. Anterior two-thirds, chorda tympani, that's facial. Posterior one-thirds, glossopharyngeal. Posterior most part who carries special sensations from tongue, vagus. So there's a common nucleus for 7th, 9th, and 10th cranial nerves. That's an afferent nucleus. That's the nucleus of tractus solitarius. Clear, students? So just once again recapitulating, just revising this. Afferent components, efferent. Efferents we had, number 1, special visceral efferent, supplies the muscles of pharyngeal arches, present in 5, 7, 9, and 10 cranial nerves, and then you have the nucleus. General visceral efferent supplies the glands, present in 3, 7, 9, 10 cranial nerves, you have the nucleus. General somatic efferents, yes, supplies the extraocular and tongue muscle, present in 3, 4, 6, and 12, you have the nucleus. Coming to the afferents, general somatic afferent carried by the 5th nerve through its 3 nucleus, mesencephalic, chief sensory, spinal nucleus. Special somatic afferent, smell, vision, and balancing. So those nerves. General viscera, vagus, general visceral afferent, and special visceral afferent is the tongue. So 7, 9, and 10 nucleus will have this. The common nucleus is nucleus, and the 7, 9th, and 10 nerves will have this. The common nucleus is nucleus of tractus solitarius. Now, students, just understand. I'll just tell you one short. Now, say for example, facial nerve. What is the facial nerve supply? If you know this, you know the components, and those components will have the nucleus. Say for example, facial nerve. Facial nerve supplies all the glands except parotid. To supply the glands, what is the component which the facial nerve should have? Glands, general visceral efferent. And what is the name of the nucleus of this component? Superior salivatory and lacrimatory. What else is the facial nerve supply? The muscles of second pharyngeal arch. Name of the component? Special visceral efferent. Name of the nucleus? The motor nucleus of facial nerve. What else is the facial nerve supply? Tongue. Special sensations. So what is the component? Special visceral afferent. The name of the nucleus? Nucleus of tractus solitarius. You understanding? So facial nerve, what are the functional components? Special visceral efferent, general visceral efferent, and special visceral afferent. This would be the functional components. What would be the nucleus of facial nerve? Number 1, motor nucleus of facial nerve supplies the muscles of second arch. Superior salivatory and lacrimatory nucleus supplies all the glands except parotid. And nucleus of tractus solitarius supplies the anterior, gets sensations from anterior 2/3 of the tongue. Clear? So that's how the components are, that's how the nucleus is, and then you have to know the course of the nerve, the distribution, and the clinical anatomy. So I hope, students, this lecture is clear to all of you. The functional components, that's a very complicated lecture, but okay. So that's the same slide which we have seen previously. This is a complicated lecture, students. I hope this is clear to all of you. Go through the functional components. You have to revise it again and again. It is difficult, no doubt. You have to revise this functional components, understand the components, understand what this component would supply. Then you would be able to understand this component would be present in which nerves, and this nerves will have the corresponding nucleus to supply the organs. Like say, for example, a quick go through oculomotor nucleus. What functional component does it represent? Yes, anyone? Oculomotor nucleus. It belongs to the third nerve. So, general somatic efferent. Understanding. The mesencephalic nucleus of trigeminal nerve. What component? General somatic afferent. Hypoglossal nucleus. What component does it represent? That's how the MCQs you get. Hypoglossal nucleus. General somatic efferent. Right? Nucleus ambiguous. So nucleus ambiguous supplies the muscles of pharyngeal arches. So what component is it? Special visceral efferent. Dorsal nucleus of vagus. Dorsal nucleus of vagus supplies the gland. So what component? General visceral efferent. Right, students? Vagus nerve. What component does it represent? Vagus nerve. Vagus nerve represents general visceral efferent component, nerve. So students, I hope this lecture is clear to you. Keep on revising, keep on revising. In case of doubts, do get back to me. Thank you to all of you for this patient listening. Thank you.